What up, fellas? It's Ty. Welcome back to the channel where we discuss all things prostate and prostate cancer related. If you're new here, welcome to you. If you've been here for a while, watch the video, maybe even liked and subscribed, I appreciate you and welcome back. So today we're going to discuss a topic that I wanted to share with you all because I recognize that I have mentioned it on numerous occasions and I have not explained it very well. And I take it for granted because I'm all enlightened now on how to have a discussion with my doctor, but that's only because my wife's a medical professional and she taught me how to do that. And so I can't take for granted that you all know what I mean when I say have an informed discussion with your doctor. So we're going to talk about it. So when you go to your doctor's office, we're going to deal with the elephant in the room. As a man, you do not want to be there. I am sure that if there was one more thing that you could try, you probably wouldn't be in the doctor's office. And with that being the case, you don't want to be there. First question is, how are you doing? Fine. What's going on? Well, I have a pain here. Well, how long has it been going on? I don't know, a couple weeks maybe. Y'all have to learn to be specific. You need to know when the onset was. Meaning, when did it start? How long has it been going on? How bad is it? 0 to 10. You need to have an idea if you're in pain, how bad it is. Because if you ask and they say, well, this is the worst pain you ever had, well, even in work evaluations, 10 is way, way over there. But maybe you are 9 or 10. You need to determine that before you get in there. How bad is your pain? And you need to discuss that with your doctor, be able to tell them what's going on. If you are not able to pee all the way, tell them that you're hesitating. Tell them when. If you're doing something and it feels better, tell them when you're doing something and it feels really badly. I had told my doctor one time that I said, hey, listen, when you put me on that blood pressure medicine, it really helped my penis. This is when I was growing my prostate cancer and didn't know. And he's like, what? And I said, yeah. Now, I thought this was inconsequential. But I shared this with him, and he was like, you know what? With that being the case, we probably should put you on the Cialis, 5 milligrams a day. That's how I ended up on that. And I'm just telling you, discuss every piece of what's going on. Now, how do you do that? There's also a caveat. If you need to share something with your doctor, you need to tell them early in the visit. There are some doctors that will sit down and have a conversation with you about how you feel and get that information out of you. There are other offices where you feel like cattle. You feel like you are in there and they're trying to get you the hell out of there so they can get the next person in there and get them the hell out of there. So you don't have time. So you make sure that you let them know, hey, listen, after you ask me all of your questions, I have a question for you. Or I have something I want to share with you. Or I have something I want to talk to you about. And make sure that they are clear that you have their full attention. Because make sure you have your doctor's full attention. There's a lot of things that go on in regards to this prostate cancer thing before we have it with our diagnosis and afterwards, that when we go to our visits to get our PSA checked, to get our blood drawn PSA checked, to get checked for a UTI, that if you are not sharing that stuff with your doctor, you're doing yourself a disservice. It may be something small to you, but it may be an indicator of something else. If you looked at one of my videos, I was telling you how I had a UTI, or I thought I had a UTI and chronic prostatitis, and nobody ever told me that it was an indicator potentially of prostate cancer. So you have to keep all of that stuff in mind. You go to the doctor's office, be specific.